My name is Gabriella David.
Hi, I'm Heidi John.
And I'm Shannon Regal, and today we're going to be teaching you about the prevention of diabetes mellitus.
Diabetes, prevention of diabetes mellitus. Healthy People 2020 goal, reduce the disease and economic burden of diabetes mellitus and improve the quality of life for all persons who have or are at risk for diabetes. This is our objective subcategory. D1, reduce the annual number of new cases of diagnosed diabetes in the population. Over here we have some statistics on the cases of diabetes diagnosed each year. Although there's a slight decrease in recent years, the overall trend is an increase, which shows that this is still an increasing problem. These are our objectives. Objective number 1 is peers will verbalize understanding on how to screen individuals who are at high risk for diabetes. Objective 2 is peers will demonstrate an understanding on how to educate patients with high risk for diabetes, how to modify risk factors to prevent diabetes. Number 3, peers will demonstrate knowledge of the complications of diabetes in a way to effectively educate their patients on them. This technique is used to motivate clients into adhering to preventative practices. Over here we have some modifiable risk factors and non-modifiable risk factors. On the modifiable risk factor side, we have physical inactivity, high body fat or body weight, high blood pressure, and high cholesterol, while the non-modifiable risk factors include history of gestational diabetes, race and ethnicity, age over 45 years, and family history of diabetes.
Non-modifiable risk factors, family history. If you have a blood relative with diabetes, you are at risk for developing it your risk for developing it significantly increases. Race or ethnic background. If you are African American, Asian American, Latino Hispanic American, Native American, or Pacific Islander descent, you have a greater likelihood of developing diabetes. Age. The older you are, the higher your risk. Generally, type 2 diabetes occurs in middle-aged adults, most frequently after 45. However, healthcare providers are diagnosing more and more children and adolescents with type 2 diabetes. History of gestational diabetes. If you have developed diabetes during pregnancy, you are at an increased risk. The modifiable risk factors: inactivity, obesity, BMI, hypertension, hyperlipidemia. Inactivity. Physical inactivity is associated with increased insulin resistance and poorer glycemic control independent of body weight. Primary findings demonstrated that the unfit individuals with obesity have a greater mortality risk than those who are obese but fit. Obesity is considered 30 kilograms or higher. Obesity affects an estimated 72.5 million people in the United States. Despite efforts to address this epidemic, the number of states with a prevalence of greater than 30% increased from 0 in 2009 to 9% in 2009. By 2020, the overall prevalence of prediabetes and diabetes in the USA will be approximately 50%. Abdominal obesity and inflammation of fat tissue appears to be a factor in the development of insulin resistance and subsequent type 2 diabetes. Hyperlipidemia. Insulin resistance and type 2 diabetes are associated with a clustering of interrelated plasma lipid and lipoprotein abnormalities, which include reduced HDL cholesterol, a predominance of small density LDL particles, and elevated triglyceride levels. Low HDL, good cholesterol, and or high triglycerides can increase the risk for type 2 diabetes. Hyperlipidemia and diabetes substantially share common pathways such as obesity, inflammation, oxidative stress, insulin resistance, and mental stress. Hypertension is considered 140 to 159 systolic and 90 to 99 diastolic. In addition to causing damage to the cardiovascular system, untreated high blood pressure has been linked to the development of diabetes. There is a substantial overlap between diabetes and hypertension, reflecting substantial overlap in their etiology and disease mechanisms. In the U.S. population, hypertension occurs in 80% of patients with type 2 diabetes. A prospective cohort study in the United States reported that type 2 diabetes mellitus was almost 2.5 times as likely to develop in subjects with hypertension as in subjects with normal blood pressure. It is now realized that insulin resistance, which predicts type 2 diabetes, also has a role in the development of hypertension. Hypertension and diabetes substantially share common pathways such as obesity, inflammation, oxidative stress, insulin resistance, and mental stress. How to screen for diabetes when a person has high risk factors. It has recently been projected that by 2020, the overall prevalence of prediabetes and diabetes in the United States will be approximately 50%. Targeted screening for populations with increased diabetes risk can help to inform prevention or management strategies at all points of the progression from overweight to obese. Who should be tested? Testing should be considered in all adults who are overweight with a BMI of greater than 25 kilograms and also have these additional risk factors. First degree relative with diabetes, physically inactive, members of a high-risk ethnic population, women who are diagnosed with gestational diabetes. Hypertensive patients or on therapy for hypertension, HDL cholesterol less than 35 milligrams, women with polycystic ovary syndrome, an AC1 of greater than 5.7, impaired glucose tolerance or impaired glucose fasting on previous testing, other clinical conditions associated with insulin resistance such as obesity. In the absence of the above criteria, testing for diabetes should begin at age 45. If results are normal, test taking should be repeated at least 3-year intervals or more frequent depending on the initial risk status. Screening for prediabetes. The statistics show that the number of individuals at high risk for developing type 2 diabetes is 3 times greater than the number of individuals who currently have type 2 diabetes. Lacking intervention, roughly 1/3 of these patients, over 25 million individuals, will progress to diabetes. Patients with prediabetes have impaired fasting glucose, impaired glucose tolerance, or both. Ways to screen for prediabetes. Fasting plasma glucose test. This checks the patient's fasting glucose levels. The nurse should inform the patient that they should stop eating 8 hours prior to the test. Prediabetes would be 100 to 125. Oral glucose tolerance test. This is a 2-hour test that checks the patient's blood glucose levels before and 2 hours after the patient eats or has a sweet drink. The levels for this would be 140 to 199. Patients with prediabetes should be monitored annually with fasting plasma glucose and A1C. Measurements as well as a 2-hour post-challenge glucose tolerance test when progression is suspected. Nursing assessment, subjective data. Past health history of the patient should include history of infections, recent trauma, Cushing syndrome, a previous birth greater than a 9-pound infant, family history of diabetes. Medications that they could be on that could increase their risk of diabetes would be corticosteroids, diuretics, or Dilantin. Activity and exercise. Is the patient physically active? Do they experience fatigue on a regular basis? Abdominal pain, headache, blurred vision, numbness, or tingling of the extremities are all abnormalities associated with type 2 diabetes. Elimination. Frequent urination and urinary incontinence are also common. Nursing assessment continued with objective data would be cataracts and sunken eyeballs, dry, warm, pigmented skin, ulcers, especially on the feet, and hair loss, abnormal respirations, weak or rapid pulse, dry mouth, fruity breath, altered reflexes, or change in level of consciousness, also abnormal lab values. The future of diabetes risk assessment. PreDx, or Diabetes Risk Test, is a new diabetes risk assessment tool that uses a single fasting blood sample to determine a person's 5-year risk for developing diabetes via an analysis of 7 biomarkers. It has been found that this test is actually a better predictor than A1C, fasting plasma glucose, BMI, and fasting serum insulin. The only problem with this is that some health insurances don't cover it, and others will charge anywhere from $50 to $300. This is just another risk assessment tool that you can find online or that a patient can do on their own to assess their risk for prediabetes or diabetes.
How to prevent type 2 diabetes. This is a picture showing the major risk factors that can be modifiable. You have lower your blood pressure and cholesterol, manage your weight and BMI, exercise, and eat health. As an educator, it's important to use a motivational interview at the beginning. You don't want to overwhelm your patient. Assist patient to attain small step at first. They assist you as an educator to prevent patients feeling overwhelmed, giving the patient opportunity to participate in decision-making and problem-solving. Assist patient to set up realistic goals for a 12-month period. We always want to do the small steps first. Learning patient readiness to change, identify your patient physical capability, identify barriers that can prevent patients to achieve their goals, like financial, housing, mental wellness. They are very important before you start any changes. Use the resources available, especially in the community the patient lives in. Proper referral is also very important. Manage your weight and BMI. Half of individuals with type 2 diabetes are obese, and nearly 9% are overweight. Research shows that even moderate weight loss of 5 to 10% of body weight can prevent or delay the progression to type 2 diabetes development in a high-risk adults. Assisting clients to set up realistic goals, slow weight loss over a period of 12 months is very important. We don't want slow weight loss over a period of time of 12 months is very important. You don't want to overwhelm the patient. Also, a lot of research shows that 12 months is the best way to reduce your BMI and weight. Exercise and health food choice together are important to manage weight and decrease BMI. Exercise. It lowers the risk of developing diabetes by 58%. When you are active, your cells become more sensitive to insulin, so it can work more efficiently. Your cells also remove glucose from the blood, use a mechanism totally separate from insulin during exercise. During your exercise, the glucose moves out of the bloodstream and into the cells where it is needed. Lower insulin levels and reduce inflammation. So, exercise consistently can lower blood glucose. Recommendation: CDC recommended 30 minutes exercise most of the days of the week. There is pretty much 150 minutes a week. And you start slow and increase 10 minutes every week until you reach your goal. Exercise does not have to be vigorous to be effective. Even a small brisk walk, swimming, and house chore is effective. The exercise select should be enjoyable to foster regularity, using comfortable clothes and footwear. Exercise is best done after meals where the blood glucose rises. Exercise plans should be individualized and monitored by a healthcare provider. Make exercise a fun activity. Some examples: you can exercise with another person, listen music, and go to your favorite places. Eat health. Take this small step to eat healthy. Highlights eating fruits, vegetables, whole grains, fat-free or low-fat milk and milk products, including meats, poultry, fish, beans, eggs, and nuts. Food that is low in saturated fats, trans fats, cholesterol, salt, and added sugars. Avoid processed food, avoid fruit juices and drinks high in sugar. Keep these healthy eating tips in mind. Try not to exceed the amount of calories and fat. Try to eat meals and snacks at regular times every day. Make less food look like more by savoring your meals in a smaller plate. Take your time when you eat, because it takes about 20 minutes for your stomach to tell your brain that you are full. Use the tips to assist your patient about portion control. You can use the plate method. You can see it's very simple. That shows your vegetable, fruits, grains, and protein, and dairy. Also, the hand method is good to control portion control. Low your blood pressure and cholesterol is very important to decrease your risk for diabetes. Both high blood pressure and cholesterol is linked together with the development of diabetes. Other health behaviors change: stop smoke, manage stress, limit your alcohol intake, include the entire family health behaviors, keep yourself hydrated. We have some resources available in the community. We have CDC, they have a great prevention program. We have YMCA, diabetes program. You can use MyPlate to prepare meals. We have Nation Diabetes Education Program, American Association, and the United States Department of Agriculture. There is no better time than to start living healthy.
Complications of diabetes. It is important that patients understand the complications related to diabetes. Understanding the complications of diabetes will push patients to change their lifestyle and prevent diabetes. Some diabetes complications include macrovascular complications, microvascular complications, diabetic retinopathy, nephropathy, neuropathy, complications of feet and lower extremities, and infection. Some macrovascular complications include angiopathy, which is diseases of the large and medium-sized blood vessels. Angiopathy increases risks for stroke, cardiovascular disease, and peripheral artery disease. The high amount of sugar in the blood irritates the arteries, which leads to higher incidences of atherosclerosis. Some microvascular complications include nephropathy, which is a microvascular complication associated with damage to the small vessels that supply the glomeruli of the kidney. It is the leading cause of end-stage renal disease in the U.S. As a result, the kidneys become less and less effective at filtering and starts letting things out in the urine that should not be there. These things include protein. Another microvascular complication is neuropathy. Neuropathy is nerve damage that occurs because of the metabolic derangements associated with diabetes mellitus. Basically, since blood vessels are damaged by blood glucose, it is hard for nutrients and oxygen to get to the nerves, thus leading to nerve damage. Damage to nerves causes pain for the patients in the tips of their feet and hands. This pain eventually leads to numbness. Sometimes the vagus nerve, which is the nerve in charge of digestion, can be damaged and cause gastroparesis, which is also known as delayed gastric emptying. Damage to the vagus nerve can also lead to postural hypotension, resting tachycardia, and painless myocardial infarction. Lastly, another microvascular complication is retinopathy. Retinopathy refers to the process of microvascular damage to the retina as a result of chronic hyperglycemia. Diabetic retinopathy is estimated to be the most common cause of new cases of blindness in people ages 20 to 74 years old. Complications of feet and lower extremities. Because clients are less likely to feel foot injuries from their neuropathy, they are more likely to get infected foot wounds. Therefore, from these spreading foot infections, they have to get amputations. Infection. A patient with diabetes is more susceptible to infections than other patients. The mechanisms for this phenomenon include a defect in the mobilization of inflammatory cells and an impairment of phagocytosis by neutrophils and monocytes. The nurse's role. By raising awareness, we can act together to help prevent diabetes.
Nurses in particular have an opportunity to help in this fight against the disease by counseling their patients on how to live a healthier lifestyle.
Early assessment and intervention to treat risk factors associated with diabetes can help patients prevent the potentially dangerous disease.
Nurses can seek opportunities within professional organizations to not only expand their critical knowledge about diabetes, but to also gain access to valuable resources that can help create more public awareness.
It's a nurse's job to learn about a patient's daily lifestyle and find ways to promote physical activity and healthy eating habits.
While it can certainly be a challenging job, helping patients in this way is an important part of being a nurse. Together, we can prevent diabetes.